Hi, my name is Debbie Komisak. I'm doing this video presentation on literature review. I have chosen my capstone project on teen eating disorders, and my articles I have chosen are the 5 articles that I reviewed were teen eating disorders tips and tips to protect your teen, treatment of adolescents eating disorders, progress and challenges. Third one was how to moderate online discussion forums facilitates how moderated online discussion forums facilitates support for young people with eating disorders. Number 4 was you can take it with you, delivering family-based treatment for teen eating disorders in the home setting. And 5 was a case study treating eating disorders in the community. Initially, I read and reviewed the article Treatment of Eating Disorders, Progress and Challenges. The article was to be informative about the diagnosis and treatment options of the teen eating disorders. The author's purpose of the article was to relate his findings, which are that there are few evidence-based treatments for adolescents age group that have been identified. The disorders focused on this article were primarily anorexia and bulimia, and the other ones were eating disorders not otherwise specified. The body of the article reviewed what the signs and symptoms of each particular eating disorder is and the treatments that are now available, and also their efficacy. It also reviewed some new treatments that are based on neuropsychology. His conclusions are that although evidence is limited in family-based therapy, it appears to be it's the best treatment for anorexia. There is little evidence to support any specific treatment for bulimia in the teen. There needs to be additional studies and hopefully new treatments to impact these diseases. This article relates to my capstone as it is a good resource and information into what the eating disorders in teens are and what current treatments are available. The article entitled Teen Eating Disorders Tips to Protect Your Teen was written to families to help recognize the signs and symptoms of their child having an eating disorder. Its purpose is to be informative, and it explains and lists the factors putting teens at risk for developing such disorders, such as societal pressure, genetics, and biological factors, and personality traits. This could include perfectionism, anxiety, and rigidity. The consequences of eating disorders were also discussed, providing insight to what ramifications occur with the disease. The article also articulated preventative measures a parent can do with upbringing of their child, such as prioritizing good self-esteem and good eating habits. It includes that if one suspects an eating disorder, they should reach out for medical treatment. This article is relative to my project as it provides good information on signs to look for in teens and how to promote communication and ways to help prevent the teen from developing the disorders. The article about moderated online discussion forums to support teens with eating disorders was to be informative as to how teens look for online support to help them. Due to teens' resistance for reaching out to parents for help, the teen is more likely to, in this day and age, go online and look for support when a problem arises. In this article, it was shown that many adolescents that have eating disorders do use online forums, and they find that the forums are a safe space for them to talk to their other people. They don't have to be fearful resentful or feel shame and despair with the individuals online because they support them and share in their torment. The article concludes that the author suggests that online forums facilitate support and gives the team more control over the treatment process for recovery. The article hopes to reassure caregivers and practitioners that users on the online discussion can have a safe and therapeutic environment. This article is relevant to my capstone in that it discusses treatments that are outside the box, yet very useful. I could use this content of the information to provide online discussions for the teens that I would have at the clinic where I work, to have an additional outlet for discussing their thoughts and fears. The article about delivering family-based treatment for teen eating disorders in the home setting provides information on the fact that family-based therapy is the primary intervention for treatment in eating disorders, yet despite its efficacy, family-based treatment therapy remains low, especially out of the area of specialty research settings. The article details how home-based or primary care facilities would increase access to family-based therapy, especially for those in lower socioeconomic status who otherwise may not get the needed treatment. It reviews a newly funded project entitled Project CORE, which is based in Rhode Island. It collects outcome data from healthcare providers as well as from families receiving evidence-based treatments in the home or primary care setting. This information will be evaluated for its efficacy of in-home and physician office treatment. This article is relative to my project, that it is discussing what I wish to do with my project, which would be to have a support or treatment group of teens in the clinic that I work. The final article I reviewed was a study treating eating disorders in the community. This article involves a case study of a 16-year-old girl with an eating disorder. It reviews the signs and symptoms of the disorder as well as the treatment. It is to inform the reader of the disorder and that it is multifaceted and complex. The article discusses the need for education for the teen. It concluded the importance of recognizing the symptoms and the importance of the community to be educated in the signs and symptoms of the disorder so they can be aware of the signs and symptoms and intervene for the teen. This article is relative to my project because I feel the education to the community is also important, so all could recognize the signs and symptoms of the disorders and be an advocate for our teens who suffer with them.